Hello everybody, welcome for today's lesson. The last time we have seen the introduction of antimicrobial drugs. Now today we are going to see the mechanism of antimicrobial resistance. The first one is the bacteria produce enzymes, so that either destroy the antimicrobial agent before it reaches, so the enzymes destroys the antibiotics. The second was the cell wall become impermeable, so drugs cannot enter to the inside because of the impermeability of the cell wall. The third one is the target site is altered by mutation. So by using mutation, it changes the target site, so drug cannot attach to the target site. So the fourth one is the bacteria possess an influx pump, so the bacteria will influx the antibiotics before it reaches to the target site. And the last one, specific metabolic pathway in the bacteria are genetically altered, so they cannot exert an effect. So factors that promote drug resistance include exposure to suboptimal level of antimicrobial, exposure to the microbes carrying resistant gene, inappropriate drug use, lack of quality control manufacture or outdated antimicrobial, inadequate surveillance. So all these things is the factors that promote drug resistance. So if there is low level of the dose of the antimicrobial, it may lead to the development of drug resistance. Even if the pathogens have the resistant gene, it may resist again the antimicrobials. So mechanism to reduce bacterial resistance includes appropriate drug diagnosis, appropriate diagnosis and proper selection of antibiotics. So we should appropriately diagnose the disease and properly give the antibiotics, rational use of antibiotics, proper hygienic and another disease prevention practice, and cycling the use of antibiotics. So this is the last one is very important. We should not use the same drugs at all times. Because the pathogen may adapt the drugs and may result the development of the drug resistance. So we should change to another drugs. The another one is the clinical use of antibiotics. So antibiotics can use as a prophylaxis for special conditions. So especially for fattening animals, we can use the antibiotics as a prophylaxis. We should not use drugs for trivial infections. Treatment should be based on the clinical and bacteriological diagnosis. So we should properly diagnose the disease and we should give the appropriate drugs. Antibiotics for systemic treatment must be given in a full therapeutic dose. So we should give the appropriate dose for a full length of time. So combined therapy with two or more antibiotics is sometimes required if we suspect three things. The first one is serious resistant infection, severe mixed infection, and lastly, if to achieve synergism. So this, if you suspect three things, we should use the combined drugs. So this is clinical use of antibiotics. So antibiotic drugs and their formulation. So we have preparation containing single antibiotic agents like oxytetracycline, penicillin, sulfadimetine, tylosins. And preparation containing two or more antibiotic agents includes the penicillin plus streptomycins, that may, for example, penistrip, trimethoprim, and sulfamethoxazoles. Other special preparations with antibiotic include the ointments, wound sprays, powders, intrauterine bolus, intramammary infusion. So the another part is the side effect of antibiotic the side effect of the antimicrobial drugs. So this is the important portion of the today's lesson, I think. So uh, actually, any drugs have not any side effects. Any drug, which means any drug have its own side effects. So all antibiotics, especially the penicillins, may result allergic reactions in both humans and animals. So aminoglycoside cephalosporins may cause nephrotoxicity, which means the liver, not liver, just the kidney failure. So these aminoglycoside cephalosporins may result liver failure or toxicity of the kidney, and the aminoglycoside may result ototoxicity, which means the toxicity of the ear. cephalosporins, penicillins, macrolides may result dysbiosis, which means of the uh, GIT, the GIT microflora is disturbed when we use the cephalosporin, penicillin, and macrolides. Penicillins, cephalosporins may result pseudomembrane colitis. Uh, just another one, the tetracycline, cephalosporins may result hepatotoxic, which means the liver failure or toxicity of the liver. Macrolide may result cholestasis, which means just disturbance of the liver bile duct. Chloro may result the leukopoiesis suppression, which means reduction of the leukocyte production. So it is very dangerous for both in human and animals. Tetracyclines, lincomycins may result osteogenesis disturbance, which means just which may result the reduction of the bone growth. So all drugs may result, almost all drugs may result side effects. In addition to this, I think the aminoglycine cephalosporin is just may result nephrotoxic, which means just failure of the kidney. So this is all about the side effect of antibiotics. So today we have seen actually the mechanism of resistance of the antimicrobials, the antimicrobial resistance by the pathogen, how the pathogens resist antimicrobials, and the mechanism of mechanisms that used to reduce resistances and clinical use of antibiotics is observed. And finally, we have seen just the side effect of the antibiotics. Thank you very much.